Katya and the whole Startup Health team and all of you for participating today. My name is David Weingard, founder and CEO of Cecelia Health. The day we began as a company was really the day I walked into a doctor's office with no energy, stepped on a scale. I was 30 pounds lighter than I expected and was told I had type 1 diabetes. I was 36 at the time. I'd already been a runner my whole life. I had done an Ironman triathlon, no diabetes in my family. I was completely overwhelmed, in shock, and was given a script for insulin the next day. Went looking for help in the local hospitals here in New York City, and the training classes were months away. And the information on the internet was really superficial. I needed help. And I was really fortunate to find a nurse, a diabetes expert clinician named Cecelia, who you see here in this photo, who gave me the support, the education, the sense of empowerment to live a rich life with diabetes, which thankfully I have. Went on to give back to the diabetes community, do many more Ironman triathlons with type 1, and then realized, why are we not using tech to scale Cecelia and reach the 32 million people with diabetes in this world, and almost 1 billion people globally. And we really need to figure out how to scale her and use technology. So we're a very mission-based company focused on solving for the fact that 1 in 3 Americans by the year 2030 will have diabetes, that 50% of the patients out there are what we consider poorly managed and controlled. And then if you think about it, for a health plan or a self-insured employer or providers, really 80% of the cost comes from 20% of the patients who they're overwhelmed and they need some type of personalized touch to just explain to them the why they need to take care of their diabetes, how to use the diabetes tech that's coming out. 50% of the patients are not taking their medications as prescribed, either initiating or being persistent. So doing that in a way that's scalable, that's in the language that they speak, multiple dialects of Spanish, Chinese on their schedule, and optimizing the use of omni-channel engagement. So what's unique about us? First, we lead with the human touch first. We're focused on the unmanaged population, the ones who will cost the most. And as I just said, you need to build trust and help people understand the why and get through that. We figured out how to scale. We've optimized the use of technology. We deliver over 7x ROI to our clients. We've proven this over many years. And we started with diabetes, but we've expanded over the last few years. We're wrapped around diabetes and weight management drugs. And we launched last year with one of the leading cardiovascular drugs and are rolling out cardiovascular programs with health plans now. What we figured out how to do is not only use the human touch, but integrate data from devices. For example, during the COVID world, we've been working with 12 of the largest diabetes clinics in the country, basically delivering telehealth, taking over their population and getting patients to upload their data from continuous glucose monitors, from their insulin pumps, up to the cloud, and so that we could coach them. And then when they finally do get into the office, it's a very productive visit with their provider. And they can get to the outcome, and their KPIs, their health measures, their blood sugar, their time in blood sugar range is vastly improved. And so there are 3 products in our portfolio. What we do now, the virtual coaching, where we're live with some of the largest health plans, employers, pharmaceutical company, medical device companies in the world, one-to-one relationship for a year or more with patients, doing this work, optimize human and digital touch. The second product is about integrating the devices as I just described, because once we could get people to use diabetes tech, we could manage them virtually. And then what we've just launched actually yesterday with one of the largest national payers in the country is the first virtual diabetes and mental health clinic. As you might imagine, people today are, especially in their homes, there's only 3,000 endocrinologists for the 32 million people with diabetes in this country. And imagine them being able to get virtual care, not only from their diabetes educator, but to be able to escalate to an endocrinologist to make dosing and prescribing changes. And we've set up the whole virtual clinic and went live actually this week. What makes us unique and different is, again, using not just health coaches, but clinicians. These are educators who, unlike for example, a clinician who looked at my insulin pump when I was having an outpatient procedure and asked me why I was still wearing a pager. Very scary moment, by the way. A diabetes educator would never have done that. They would have said, David, let me help you manage your blood sugars during this time and help me tactically do it. So bringing that high value expertise to the moment and then being able to get people to a healthier place. We heavily use data and analytics to segment and target the population, and we've built self-service portals for our clients like Blue Cross Michigan and others to be able to look at the engagement data and what's happening with the population and optimize the marketing that they deliver and the experience for their members. We're very results driven. We have extremely high engagement because when a Cecelia Health clinician reaches out to the patient and says, I'm here on behalf of Blue Cross X, and I'm your personal diabetes or cardiovascular or weight management coach for the next year, it's different than it's unlike a call center agent. They know they're getting an expert, and it's gonna be the same person teaching them in their corner. We're delivering measurable health improvements and, very importantly, an ROI to our clients. We've had over 1 million unique patient interactions. We have hundreds of thousands of patients. We're a B2B business. Some of the clients we work with are listed on the bottom. But really, most importantly, we're patient-centered and making sure the patient experience is awesome and that it brings loyalty to the business brands that we partner with. We launched the virtual clinic, as I mentioned. We're launching Healthy Heart as we scale across chronic care, and we're extending our capabilities to digital apps so that we can not only manage the most expensive part of the population, but the whole population as well. We're celebrating today, we just announced the close of a $13 million B1 round. All that news is on the internet so that we can scale and bring Cecelia to everyone in the US and eventually everyone on the planet. If you're interested in helping your members with diabetes, cardiovascular, obesity, and you want to make a difference in the world, please reach out to me through the contact information here. Thank you so much.
Awesome. David, congratulations on the Series B announcement. We're so excited for you. And of course, have been proud of your growth over the years. So just time for a couple questions. And feel free to throw those in the chat, folks. Talk to us about what's happened to you during this time of COVID-19. Obviously, telehealth adoption has really accelerated. So what do you think are the long-term implications for your business as a result of the pandemic?
Great question. I mean, as tragic as COVID is, it's really created a realization for everyone out there that telehealth is critical. Patients with diabetes were overwhelmed as they were. The diagnosis trending to 1 in 3 Americans. We were in a crisis before COVID. Now with people, unfortunately being homebound, gaining weight, not able to access medical care, telehealth is even more critical. And what's interesting is a lot of the tools are now available that make self-management available besides the coaching. Continuous glucose monitor, so you don't have to test your blood sugar every day. You could actually, like me, wear a sensor that gives you real-time data. Well, that takes education, training, support. And we've shown that we could take populations and by the end of 3 months, get these populations 100% persistent on the devices and using the data. And to be able to do that virtually in a telehealth environment is critical. When you think of a map of the United States and where those 3,000 endocrinologists are located, most of them are on the East and West Coast. Even here in New York, if I wanted an appointment with my endocrinologist today, it would be 3 months from now. So that, the ability to deliver telehealth and engage wherever, at any time, in the convenience of your home, from the privacy, and be able to have that resource is absolutely critical and vital. And there's been a wake-up call and an extension of our services.
I can only imagine, yeah. And that moment, the scary moment you mentioned when your insulin pump was mistaken for a pager, that really really hit home. I can imagine that was very frightening. Esther, can you come off mute and ask your question, please?
Let's see if I can handle the technology. Just briefly, I'm curious, are you suggesting that people use other monitors as well, like sleep monitors or other things? How do you mentioned a little bit about integration. Can you talk more about what other kinds of data are useful in helping people manage their conditions?
Yes, absolutely. So especially when we start with the unmanaged population, the people who are costing the system the most, they're usually walking out of the doctor's office after being diagnosed or getting lab results that are poor, not even knowing which way to turn. So we have to start with the basics and explain what A1Cs are, why you have to test your blood sugar, get them educated and motivated to address their nutrition, their lifestyle, and give them the support and motivation that they need. As we get through that phase, then we start to educate them on the devices that they can use, the tech, that can help them learn to self-manage the disease, and we can help them understand the data, and that's the next phase of education. And to your point, it's not just blood glucose data that you get from blood BGMs, blood glucose meters, or continuous glucose meters, but there's a range of sensor technology available today that affect, because diabetes affects everything. It affects sleep, it affects, wellness, stress, healthy lifestyle. So the more we could teach people to use those different sensor technology and incorporate it into their self-management is a lot of the value of our one-on-one personalized coaching.